Hi everyone, this is Richie from Pinoy Adulting 101, and today we will discuss about administrative task of a healthcare virtual assistant. So ano ba ibig sabihin nun? Ano-ano ba yung mga tasks, duties, and responsibilities ng isang healthcare virtual assistant? Yung virtual assistant na nag-work sa mga clinics and together with the doctors and healthcare providers sa ibang bansa. Okay, so ready na ba kayo? Let's start! Ayun guys, so the first one would be phone management. So we will be receiving incoming and making outgoing calls. So tayo tagatanggap ng lahat ng mga tumatawag, tagasagot ng mga lahat ng tumatawag, at gagawa rin tayo ng magtatawag din tayo sa iba, sa pasyente, sa pharmacy, sa mga doctors. So that's what we will do when we say phone management. Okay? So we will be accepting all incoming calls and we will be making outbound calls. Example of outbound calls would be informing the patient about their prescription refill, informing the doctors that we have received their referral, informing the patients about their lab results, etc., etc. And then the next task would be filing of faxes. So we will be receiving a lot of faxes, different kinds of faxes like prior authorizations, insurance approval, denial, lab results, referrals, imaging results like that, patient's demographics, patient insurance cards, etc., etc. So what we need to do is we need to file that on the appropriate patient's chart. So, ang ibig sabihin, lalagay natin, ipa-file natin yung mga faxes na yun dun sa chart ng patients, or if it's like a general memo, ganyan, then we need to send it to the proper person or authority. So, i-email natin sa ating higher ups or manager or to the doctor directly. So it depends. So we will sort and we will file different kinds of faxes. Okay? Another responsibility would be creating patients chart. So for new patients who calls us wanting to schedule an appointment, we get all their information and we create a new chart for them, a new patient's chart for them. Also, for patients that was referred by other doctors to us, then we will create a new chart for them. As well as patients who inquire via email, showing interest and wanting to schedule an appointment with our doctor, we will create a new chart for them. So we will get all their information so that we can create them a file and a chart. Okay? Or another doctor refers their patient to us, it's our responsibility to create a new patient chart as well as to call that patient multiple times and also email them to convince that patient to schedule an appointment with our doctor. And then once that patient schedules, we notify the referring doctor that the patient they have referred has scheduled with us. And if that patient did not schedule, we will inform the referring doctor that the patient did not schedule so that they know the status of the referral. Okay, so that's what we do when we say referral management. Okay, next would be scheduling of patients. So it's a responsibility to schedule new patients, to schedule established patients, to reschedule patients who cannot make it to their appointment or upcoming appointment, and also to process appointment cancellation. So if a patient calls in and tell us, "Hi, I'm calling to cancel my appointment, blah blah blah." So of course, we can't do anything about it. We just have to follow the patient's request and cancel it. But if they request to cancel their appointment, we have to at least try to reschedule it for good business so that the doctor can still see them for a follow-up. Okay? responsibility would be noting of prescription refill requests. So patients will be calling us, as well as pharmacies will be calling us, informing us that they need a refill for medication. So we need to take down the name of the medication, the dosage, the quantity, the name of the pharmacist, the name of the pharmacy, their telephone number, and their fax number. And we need to put that down and write it on the patient's chart and notify the doctor. Okay, so that's one of our responsibilities. Another task would be email management. So some doctors will give us access to their email, some will not. It depends on the trust level as well as on how many tasks they'd like to delegate to us, but some doctors will entrust their emails to us. So it's our responsibility to manage the email, respond to queries, respond to emails coming from patients, doctors, etc., etc. So that's another task, email management. Okay. Another responsibility would be to answer doctors, patients, pharmacists, medrep queries. So they usually ask for the address of the office or the clinic, the schedule, the available schedule of the providers or the doctors, what are our office hours, what are our products, what are the copay, deductible, etc. Concerns about insurance, what are the insurances that we accept, if we are accepting new patients, and how far out are we in scheduling. When pharmacists call, they call usually to ask what's the doctor's tax ID, what's the doctor's NPI number, what is our fax number, etc. So we have to be able to answer all questions. Okay, so we have to know a lot about the practice, being the frontliner of the office, of the clinic. Okay. Hi guys, so ayun, kakat ko muna yung video natin for today. So ito yung part 1 ng ating administrative task of a healthcare virtual assistant. We will create a part 2 video. So please stay tuned. Don't forget to hit like and subscribe and click the bell button for notification para updated kayo pag meron tayong bagong uploaded na videos. And of course, para notified kayo kapag ready na ang ating video number 2 for the administrative task of healthcare virtual assistant.